We're doing this research because we know that pregnancy is a time that's really important for the future health of a child. We know that for a woman, it's a time of enormous psychological and physical change. And we do know that sleep changes quite a lot across that time frame. There's reports of that occurring. And often when a woman goes and talks to their midwife, they're told that that changes in sleep are just a normal part of what's going on. But we don't actually know what constitutes normal and when it might become a problem for women. There's a research that's now emerging that is showing that there might be some quite important consequences of changes in sleep for pregnant women, particularly their babies being born early, the way that they can process sugar during pregnancy. There's some information coming out showing that they might have longer labours, and they might be more likely to have problems with their mental health. Our research is focused on looking at how sleep changes across that perinatal period from pregnancy through to postpartum, and an understanding whether there are particular relationships between sleep and what happens at the birth of the baby, and sleep and the mental health of the mother. So we have been able to study a really large group of women in New Zealand, and about a third of our sample are Māori women. And what we've been able to determine is that we've been able to compare the sleep of pregnant women to the sleep of a large sample of non-pregnant women, and we've been able to show that sleep changes slightly in terms of the amount of sleep that women are getting, but the most profound change has been that there's a lot more women getting very short sleep, 6 hours or less a night, and a lot more women getting very long sleep. Some of the other things that we've been able to show is that the rates of depression and anxiety in pregnant women are quite high. For Māori pregnant women, about 22% of them have clinically significant symptoms of depression, and about 15% of non-Māori women. And the rates for anxiety are slightly higher again. My theory is that pregnancy is a critical time, and if we can understand what's normal in pregnancy and understand when to intervene, we can improve both pregnancy and also the postpartum timeframe for women and their children. We can make a massive difference to some of these women's lives if we can better understand what's okay and what might not be okay. So we've talked about how sleep might be changing in pregnancy, and we've talked about that we've got potentially higher rates of depression and anxiety in pregnancy. And the other thing we're doing is looking at the relationship between the two. So we've been able to show that women who do have very short or disturbed sleep in pregnancy, that is associated with higher rates of depression at that time frame as well. And now what we're trying to look at is whether sleep in that time frame also is related to birth outcomes, and also sleep in that time frame, how it relates to mental health later on as well. And none of this work would have been possible without having the HRC funding that has allowed us to survey so many women and to be able to structure our sample so that we're able to look at Māori women with as much statistical power as we are for non-Māori women. So we're able to make a major contribution to both New Zealand women as a whole, Māori and non-Māori, and to the international scientific evidence around sleep and the relationship with health during pregnancy.